Welcome back to Med-Surg Knowledge Nuggets, where we take big nursing topics and break them down into manageable, test-friendly content. Today we're tackling arteriosclerosis and atherosclerosis, two terms that often get lumped together but have distinct features that you'll need to know for your exams and real-world nursing. Let's start with arteriosclerosis. So arteriosclerosis is a general term. It's an umbrella term that you'll see a lot. It describes the thickening or hardening of arterial walls. So basically those vessels that carry blood away from the heart are affected. This process is most commonly associated with aging, and it causes the arteries to become stiff and less elastic, which affects how well the blood can flow through them. There are three main types of pathological changes that fall under arteriosclerosis. The first one is medial calcific sclerosis. This is when calcium builds up in the arterial wall, kind of like how hard water buildup is in old pipes. Arteriolar sclerosis affects the smaller arterioles and involves thickening of their walls. The one we're going to focus on is atherosclerosis, and this is the most common and the most tested on. It's when LDL, is also known as the bad cholesterol, builds up inside artery walls. This is a slow progressive disease that actually often starts in childhood. So how does this happen? So research has shown that it starts with vessel damage. This vessel damage triggers an inflammatory response by our body, and over time the vessels become hard and thick and these plaques form. If the plaque ruptures or narrows the artery significantly, then it can lead to serious life-threatening events. So let's talk about risk factors, and we should always know what the risk factors are for our exams. First one we have is elevated cholesterol, and this is the most well-known risk factors for atherosclerosis. So too much cholesterol, especially LDL, which is that bad cholesterol, will contribute to plaque formation in the arteries. High triglycerides, which are fats in the blood, can also lead to the thickening of the artery walls and contribute to that hardening. High LDL, which I just mentioned, is the most atherogenic, which means it directly promotes the formation of atherosclerotic plaques. So we're definitely going to be paying attention to a patient's LDL levels when we are identifying if they're at risk for atherosclerosis. A low HDL, remember HDL is our good cholesterol, is also problematic. So we don't want low HDL, we want high HDL. If you have a low HDL, that means that the LDL will stick around longer, increasing the risk of atherosclerosis. Hypertension, so high blood pressure, can damage the endothelium, which is the inner lining of the arteries. So when you have this type of damage, it makes it easier for that bad cholesterol, that LDL, to accumulate and start that plaque formation. Diabetes mellitus, another major risk factor. So high blood glucose levels can damage blood vessels and actually make the progression of atherosclerosis go much faster. So patients with diabetes often also have coexisting high cholesterol and hypertension, which actually compounds the risk of atherosclerosis. Smoking is bad, and this is a double whammy. It damages the endothelium, increases inflammation, and actually lowers HDL, which is our good cholesterol. It causes our vessels to constrict, and it reduces oxygen. Family history. This is important to ask about family history because genetics play a huge role in cholesterol metabolism, blood pressure regulation, and even how the body responds to insulin. So if a patient has family history of some type of atherosclerosis, then we want to screen them to see if they also have atherosclerosis. Obesity, especially abdominal obesity, which is where you hold the weight in your abdominal area. It is strongly linked to insulin resistance, elevated triglycerides, and a low HDL, which all can accelerate the plaque buildup. And finally, a sedentary lifestyle. Not having lots of activity in your everyday routine contributes to almost all of those things that we just mentioned. A lack of exercise can lead to weight gain, insulin resistance, and decreased HDL. Again, HDL is that good cholesterol. So the more risk factors a person has, the greater the likelihood of developing atherosclerosis and the earlier it may begin in life. That's why identifying those risk factors and modifying those modifiable risk factors is going to be a cornerstone of treatment and nursing care. Now let's talk about symptoms. These can vary depending on which artery is affected, but we're talking about the major complications first. So myocardial infarction. So this is when the coronary arteries are affected, when you have plaque in those arteries and they begin to narrow. If they begin to narrow so much, they'll actually cause an obstruction of blood flow, which can be life-threatening. Sudden cardiac death, directly tied to what I just mentioned. Stroke. So this is when one or more of the arteries that actually leave the heart to feed our brain with oxygen-rich blood become obstructed. Gangrene, so if you don't have blood flow with oxygen-rich blood to a limb or to a finger, then it will begin to die, it will become ischemic, and it will turn gangrenous and will lead to amputation. So in general, these symptoms usually will appear when the artery becomes critically narrowed. So early detection and management are vital. Now let's talk about some interventions and treatments, which are what we actually do to manage arteriosclerosis and atherosclerosis. So first, medications. We're going to focus on what's causing the damage and what we can do to slow the progression. Once you have atherosclerosis, you can't reverse the damage and get rid of the plaque. So we are going to focus on slowing the progression, or better yet, preventing it from happening altogether. So antihypertensives, these are key. This will keep the blood pressure within target range and hopefully reduce the stress on those artery walls that will in turn slow down the thickening and hardening process. Classes like ACE inhibitors, ARBs, beta blockers, or calcium channel blockers might be used depending on the patient's situation or medical history. Lipid-lowering agents, especially statins, those are the ones you're going to see used most common to treat cholesterol. So not only do these drugs lower LDL cholesterol, they also help to stabilize the plaques that are already there and reduce the inflammation, so hopefully it doesn't get worse. So here's the important teaching point. These medications are usually long-term or even lifelong, so the patients have to be educated about compliance and adherence to the plan of care. The patients may not feel different taking them, but they are helping them prevent, an MI and a stroke, behind the scenes. So next are lifestyle interventions. So lifestyle modifications are often harder than medications, but they are just as important, if not more important. So start with the diet. Patients should follow a heart-healthy, low sodium, low saturated diet. The Mediterranean or DASH diet are good examples of information you can give the patient to take home with them. You want to think more fruits and vegetables, whole grains, lean protein, and healthy fats like olive oil. Smoking cessation. So smoking does nothing good for our body, and stopping that bad habit is going to be paramount. So tobacco damages vessel walls, speeds up plaque formation, and lowers HDL, which is our good cholesterol. So for these patients who are smoking, we want to offer support. We can recommend nicotine replacement, like a nicotine patch, counseling, or even referrals to smoking cessation programs. Physical activity. So we want to encourage physical activity, 30 minutes a day, 5 days a week of moderate intensity exercise, like walking, can improve circulation, it can boost your HDL, lower your blood pressure, and even lower your weight. And here's where teaching comes in. So as nurses, we're often the bridge between diagnosis and lifestyle change. So help patients set small, manageable goals and reinforce the why behind each intervention. When patients understand why they're being asked to do this, they are more likely to comply. So don't forget your role in nursing education. We want to support them with realistic goal setting and encouragement. Now let's talk a little about surgical options for atherosclerosis. So typically a patient who has atherosclerosis will not require surgical management unless the patient has a severe form or irreversible manifestations, like if a patient has chronic chest pain, tissue death that has led to gangrene, or if a patient is at very, very high risk for a stroke. So some procedures might include angioplasty, that's where a balloon is used to open up narrowed arteries, stent placement, where they insert a stent to keep an artery open, or bypass surgery. This is where they reroute blood around a blocked vessel, usually or commonly done in the heart. So one thing to note is that these procedures don't cure the disease. They treat the symptom or the blockage. So post-operatively, everything that we just talked about, the medications, lifestyle, monitoring, still apply for these patients. Okay, so how do we assess for atherosclerosis? We're going to start with a comprehensive cardiovascular assessment. We're going to thoroughly review the patient's personal and family medical history, especially regarding cardiovascular conditions like diabetes and lifestyle factors like diet, exercise, and smoking. We're going to ask about symptoms like chest pain, shortness of breath, leg pain with walking, which is called claudication, and any history of stroke or mini strokes, which are called TIAs, transient ischemic attacks. We are going to assess their blood pressure. We're going to monitor for hypertension, as we know that high blood pressure will damage the arterial walls and accelerate that plaque buildup, so blood pressure is a very important vital sign. We want to take readings in both arms and possibly legs. We're looking for discrepancies, which could actually suggest peripheral vascular disease. We're going to palpate pulses, so we want to make sure that they are present, that they are equal bilaterally, and we will also want to know the strength. So if you find a patient with diminished or absent pulses, this may indicate that there is some arterial narrowing or even an occlusion. This is especially important in the lower extremities when assessing for peripheral artery disease. We want to auscultate for bruits. So you're going to use your stethoscope to listen over major arteries such as the carotid artery, abdominal aorta, and femoral arteries. And a bruit is a swishing sound, so that is what you're looking for. If you hear a bruit, that suggests that there is turbulent blood flow, which is often caused by those narrowed or hardened arteries due to plaque. Now we're going to move on to the labs. We're going to start with a full lipid panel. You want to know what their total cholesterol is, their LDL and HDL. Remember that high LDL is what helps to create plaque in the first place, and low HDL means that the body isn't clearing out that cholesterol like it should. We're going to check the triglyceride level. When these fats rise, these fats rise with obesity, poor diet, and uncontrolled diabetes, and they're another contributor to arterial plaque. We're also going to check homocysteine levels. So high homocysteine can damage the endothelium, which is the inner layer of the vessel, and increase the risk for clots. It's not always standard to check homocysteine levels, but it's a good marker when assessing the cardiovascular risk, and you look at the whole clinical picture. Finally, we're going to check the A1C. So the A1C gives a picture of long-term blood glucose control, typically over 2 to 3 months. A high A1C means that there's chronic damage to the vessels, especially in a diabetic patient, and managing it can actually slow the disease progression significantly. Nugget of knowledge for atherosclerosis. So to recap, arteriosclerosis is our umbrella term, but atherosclerosis is the real exam target. So you want to know the risk factors, recognize the complications, and understand both medical and surgical interventions. If there's one thing to take away, it is that atherosclerosis is preventable and manageable. So you play a huge role as the RN in recognizing the early signs, educating patients, and promoting healthy lifestyle changes. Thank you for watching. If this helped clarify things for you, please be sure to like, comment, and subscribe for more Med-Surg knowledge nuggets just like this one. See you in the next video.